The purpose of the school readiness physical examination is to detect any health or developmental problems that might impede a child's success in school. As with any office visit, a thorough history must be obtained. This history should focus on factors that might put the child at risk for problems in school. Such risk factors include prematurity, exposure to drugs or alcohol in utero, central nervous system infections, chronic disease, and recurrent otitis media. Also ask the parents if they have any concerns about the child's development and ability to perform well in school. Growth should be assessed. Height and weight must be obtained and plotted on a standard growth chart. Also obtain a hemoglobin or hematocrit at the end of the examination. Any nutritional deficiencies should be addressed since they are frequently implicated in poor school performance. Obtain a specimen for dipstick urinalysis as a general screening tool for metabolic disorders or kidney problems. Measure and chart the blood pressure. Review these results with the child and the parent. Immunization status must be determined. Schools have the right to exclude children who are not up to date with their immunizations. Ask if the parents have the yellow child's immunization record and any forms to be filled out for the school or need other documentation of the exam or vaccinations. Next, the child's vision is checked using a Snellen chart or a Titmus machine. This testing also provides an opportunity to evaluate the child's ability to follow directions. If you are unsure if the child understood what was expected of him or was uncooperative, ask the parent if the child shows signs of difficulty seeing at home, such as sitting very close to the television or squinting. If the parent has no concerns, chart the results as questionable and retest in 3 to 6 months. If the parents feel that the child may have some visual problems, referral is indicated. Then audiometry is performed. If the child has had frequent bouts of otitis media, a conductive hearing loss may be present. Decreased auditory acuity may in turn result in delayed language development and poor school performance. Again, if you are unsure if the child understood the instructions or if he was uncooperative, ask the parent how she feels the child hears. Does he turn the volume of the television up and complain that he can't hear at the level that everyone else can? If not, chart the results as questionable and retest in 3 to 6 months. If you or the parent have concerns about the child's hearing, referral is necessary. Also assess for developmental readiness for school. There are many different tools for this. One of the easiest is Draw a Man. This tool allows you to assess the child's ability to follow directions, his attention span, as well as his fine motor skills, including how he holds the pencil. Ask the child to write his name, if he can. Does he know his letters? Does he have sufficient fine motor control to write legibly? Ask him to identify several colors. You may use objects around the office. This gives evidence of verbal ability and clarity of speech, as well as of basic knowledge and development. Here, the child is identifying the yellow pen and the black pen. Before starting the exam, always first
recording?
wash your hands.
So I'm going to check your eyes and your
The
ears.
sequence of the examination usually can follow that of an adult, although any painful procedures such as hemoglobin assessment and immunizations should be left until the end.
I'll have you hold that, and then we'll just set this right here.
Always
so we know
explain to the
exactly
child
that
what
is,
you are
okay?
going to do.
And then we have all these
Allowing him
pictures.
to hold your
Okay, so first of all,
stethoscope or a
I'm gonna
tongue
start with
blade
the head,
may
okay?
help
So
him
let's start
feel
with the
more at
head.
ease.
And just look at
First,
the
assess the head.
Any lumps or bumps
Check
on
for
the head?
masses,
Good, Jim.
lesions, and also for pediculosis.
And what?
This is a very common condition in children in school and daycare. Many school days are missed each year due to
Big
lice.
thing right there,
Since
huh?
children must be excluded
Okay,
from
good.
school until they are
Next thing we wanna
nit-free,
do is just look at your eye
caution
here.
the
So
child
just
against
look
sharing
right here at my
combs and
nose,
hats
okay?
and other
So
objects.
look at your eyes.
Examine the lymph nodes and the
Good.
neck.
All right.
Evaluate the
Good.
conjunctiva of the eyes.
Shine the light
Conjunctivitis
right
or
in the
pink eye is also a common condition in daycare centers and
Perfect.
kindergarten. Assess direct and
Good.
consensual
Okay.
pupillary
I just want you to
response
watch this as I move it, okay, without moving your head. Okay, we're gonna
and
go over to the side
extraocular
over here,
movements.
and then back over here. And I'm gonna
A
bring it
child
up
of this age should be able to
and
keep his
down.
head
You
still
know how to do
while
this,
following
huh?
the moving
And
object
over
with his
here,
eyes.
and up and down. Okay, can you look at it right here again?
Check
All
for
the way in.
convergence
Put it all the
and
way in.
accommodation.
All right, good. Okay. So what I want you to do is just
The cover
um,
uncover
okay.
test remains
my
an
finger.
important part of the examination in this age group. If strabismus is not detected
Look at my finger.
and treated before 9 years of age, extensive visual loss can occur. Strabismus may also be a marker of other
I already checked your
ophthalmologic
vision
or
on the
systemic
chart, so
diseases.
The next thing to do is what I want you to do is just look over here.
Finally,
Just
a
stare right over
fundoscopic
there, that
exam
spot
is
over there.
performed.
Okay, you're looking over at the spot.
Again,
And I'm gonna
a
get
child
real
in
close
this
to you with
age
my
group
flashlight.
should be able to follow
Real close to you.
instructions and
Looking over there.
cooperate during this
Get the light look okay?
examination.
Because I can't see any light. There it is.
Next, the
All right,
otoscopic
so you just
exam
wanna
is
check your ear
performed.
back here.
Show the child the
Does that hurt
otoscope
you?
with its light.
Okay.
If the child understands that all you are doing is shining a light in his ear and looking, he is generally
Good.
cooperative.
We could say we're gonna do the other one the same way.
Okay.
Roll this way. We're gonna do
So
nose.
the next thing we're going to
Check
do
the
is
nares
check your nose,
for
all right?
patency
So check your
and
nose.
visualize
Yes,
the mucosa.
Good, Jim.
that's good. And the other side? That's good. Tip your head back just a little bit. I'm not going to use a speculum. Is that okay, Cricket? Can I get by with that? And we're going to look right. Okay, good.
When
All
examining
right,
the
so that's
mouth,
nose. And we have
pay
these tiny
particular
pictures
attention
here.
to
Can you pull that out
dentition.
for me? There you go. All right. Let's have
Corner
you first
bounces
look up
out
at
again on
me
yours, Brian. I know.
and smile real big.
Many children in this
Look
age
at
group
that.
are already
Look at
starting
that.
to
Look
lose
at
their
your
primary
gums. Do
teeth.
you brush your
Yeah,
teeth?
good.
You do? Okay, good. All right. Can you stick your tongue out at me? Like, okay, open your mouth real
The
big.
importance of good brushing
stay
and flossing,
Ah,
dental visits as
okay,
recommended,
lift your tongue up.
and healthy snacks should
That's
be
good.
stressed.
Okay, now what I'd like to do is just use this for a minute, okay? Because I just want to look over here at the sides. Can you open your mouth
You
real
get them
big?
to look towards.
Examine the mouth
If you look
Thoroughly.
over
thoroughly.
We can see what little.
You may
more
use
is-
the tongue
Turn his
blade.
head left just a
There
tad.
it is.
Your
Have
whole
you turn
position.
this way.
Turn the whole head. Hold his head up. There you
There
go.
we go. Okay, now.
That's it.
There we go.
Oh, perfect.
At that,
Okay.
yeah.
Now we're just gonna look. Oh, look at that.
Check the
Look at
gums
these teeth
and
up
buccal
here.
mucosa for any lesions.
Okay, good. Now say ah. Ah. Good. Now you can stick your tongue open your mouth real.
Examine the nodes and the thyroid gland, checking for any masses or areas of tenderness. Some children of this age are quite modest. If so, try to keep the child covered as much as possible. This is especially true if there are several siblings in the room during the examination. Assess the heart in the sitting position. Palpate for the PMI. Palpate for thrills and observe for heaves. Again, observe the skin for any lesions or abnormal markings. Auscultate the heart. Use both the bell and the diaphragm. Auscultate the lungs using the bell for the apices. Have the child take a deep breath through his mouth and listen throughout the inspiratory and expiratory cycle. Use the diaphragm for the lower lobes. It is never too early to talk about the risks of smoking. During the lung exam is a good time to do this very important health promotion teaching. Examine the back. If there are abrasions, lacerations, or bruises anywhere on the skin, ask the child how they happened. Ecchymotic areas on the back, buttocks, or back of the legs are especially indicative of physical abuse. If the child's story doesn't fit, consider abuse. Check the posterior thorax for respiratory expansion and percuss and auscultate the lungs. Have the child lie supine and listen to the heart again with both the diaphragm and the bell. Explain what you are doing and listen in all 4 valve areas. Again, drape the child carefully. Inspect and auscultate the abdomen. You might allow the child to listen to his own heart while you percuss and palpate the abdomen. Children of this age enjoy listening to their heart. This distraction can prove particularly helpful with the ticklish or apprehensive child. Remember to inspect the abdomen, then percuss, palpate lightly for masses or areas of tenderness. Sometimes the child will need help understanding what he is listening to. Continue the abdominal exam with deeper palpation. Bending the child's knees may help relax the abdominal muscles. Palpate for the liver edge and palpate for the spleen. Check the femoral pulses and compare with the radial pulse. At this time, the genital exam can be performed, as was demonstrated in the 6-month-old portion of this video. The child who is starting school will be going out into the world without his family and coming into contact with many new people. It is important that he understand what appropriate touching is and what to do if it occurs. Explain to the child that it is okay for you to examine him because his mother or father is in the room with you. Perform a brief musculoskeletal exam. This is a time when many children start to participate in team sports, so it is important that any musculoskeletal problems be detected and treated in a timely manner. Check the reflexes. Explain to the child what you will be doing and that it will not hurt. Again, the plantar response is the same as that of an adult. A Babinski response at this age would be an abnormal finding. Inspect the toes and the feet for lesions. Reflexes of the upper extremity are elicited, again checking for equality. To check motor coordination and cerebellar function, have the child touch each finger to the thumb of the same hand, or touch the index finger to the nose and then to your finger. Note how much more difficult these tasks are for a child of this age than for the school-age child in the next portion of the video. Now, back for abnormalities and lateral curvature of the spine. Palpate the spinous processes or for any tenderness. Again, you are inspecting the skin of the back and the buttocks area. Have the child bend forward and assess for any asymmetry as the child slowly stands erect. The Romberg, standing on one foot, and different types of gaits can give further information about neurological status. Note the differences in the ability to stand on one foot of the children in the preschool, school readiness, and school-age portions of this video. As always, share your findings with the family. Answer any questions and address any concerns. Safety is an extremely important issue for this age group. Pedestrian safety, the use of bicycle helmets, seat belts, or booster seats in the car, and safety rules regarding strangers should all be discussed with the child and family. Remember to discuss issues related to nutrition, dental care, immunizations, appropriate caregivers and sitters, as well as addressing concerns that the family may have. This completes the school readiness physical.